like our waiting room kind of slowed down there. So hi, everyone. I'm Shaquel Balloum, a program analyst on the Women's and Infant Health team at AMCHP. And I'm thrilled to be your moderator today for our Q&A session for a multifaceted approach to addressing chronic disease prevention and stress reduction for childbearing women of color at risk in New Jersey. We have our speakers, Carrie and Christine. So before we get started with questions, I'll actually turn it over to you two to introduce yourselves.
Everyone, thank you for joining and thank you for watching our presentation today. My name is Christine Ivory, and I'm the Project Director of the Prematurity Prevention Initiative, a program of family health initiatives and a subsidiary of the Southern New Jersey Perinatal Cooperative.
Good afternoon, everyone. Thank you for being here. My name is Carrie Millen. I'm the data analyst for the same organizations Christine mentioned that I'll give you the abbreviations for, PPI, which is a program of FHI, which is a subsidiary of SNJPC. Nice to see you all.
Thank you, Christine and Carrie. So I'll actually take this time to give folks some time. If you have questions, feel free to unmute yourselves or add them in chat. Now, also, I'll turn it over to you, Carrie and Christine, as well, if there is some other feedback or observations or things that you'd like to share with attendees or questions that you'd like to ask them about, like what they're seeing in their states. I encourage you to do that as well.
Absolutely. Once again, thank you everyone for joining us today. As we're thinking about the presentation and the overall encompassing theme about community-driven approaches and really hearing the community's voice, as well as making sure that the programs that we're using to serve communities are efficient, that we're checking in with those populations, that it's really meeting those qualities that you intend to meet with our pre and post tests and all the different qualitative and quantitative measures. So really long question, but the short answer that I'm trying to get to is, are you all working on any projects, particularly around food insecurity or around chronic disease or anything underneath the sun? I would love to hear about it, and also hear about how maybe our presentation maybe sparked a light or something that would be very similar, something that you're already working on. I'm just coming back and just asking again and shortening up my question a bit, but does anyone have any projects that you're working on that are very community-driven approaches? You might be working with some stakeholders or getting that needs assessment together right now to do an informed strategy list for some of your communities or a community in particular?
And you all, I'm not sure if someone's speaking and they're still muted, but feel free to unmute yourself if you want to jump in or answer in chat.
Good afternoon, everyone. I have a question. I don't have an answer to your question, Christine, but I do have a question, if that's okay. I just wanted to know how you kept your participants engaged I know with what we do, sometimes that's difficult. And I was just wondering what you and Carrie did with your program to keep people engaged in the process, because it was over, a period of time. So thank you.
Absolutely. And Barbara, we're delighted to answer that question. For background and for everyone, Barbara is one of our colleagues from SNJPC, so glad to have you in the room with us today. As far as engagement goes, such a great question, because the program went over a 12-week period, almost nonstop. We had about a week break in between each of the 3 phases, of the 4-week phases, that is. So we really were intentional in thinking about how to engage over time. We made sure that we were asking questions and seeing the things that that the parents wanted to see that were enrolled in the process and in the group. So making sure during our pre and post tests and our follow-up tests or survey, making sure that if they wanted to know about how to make baby food at home, or how can I do some fun crafts with my kids, or make herbal tea, we really wanted to also lean onto the interests of what the women wanted and what the birthing people that were participating in the program wanted to see. And I think that really held attention in that program, as well as including yoga. Yoga was a really large piece to that when we introduced it in phase 2. And I think that that movement and really building a community around that was a really great piece to also offer for that program.
And if I might add something, Christine, I think ongoing reflection about what you were seeing in the evaluations and feedback. I thought of it specifically around the yoga. We were seeing positive feedback from participants about the yoga, and how can we bring this in more in future sessions as they were moving. So I think that ongoing engagement with the evaluations and kind of keeping that circle flowing also helped.
Thank you both.
And we also had a question come through chat. Thank you, Marisol. How are you planning to measure the impact your program had in the targeted areas as it relates to infant mortality, preterm birth rates, et cetera?
Yeah, that's a wonderful question. And Carrie, I'm going to tag team this one with you as well. What we're thinking is we have so much data that we collected around this pilot program of the 3-month seedlings program. And upon entry into the program, and you might have heard Carrie explain this out a little bit as well, that we asked women if they had a previous preterm birth. We asked women, did they experience chronic disease, or are they experiencing chronic disease in real time? And that was the reality. So around that, we shaped our program to make sure that we had some type of educational pieces, those speakers coming in to make sure that they were covering those topics. When we talk about data over time, what we're looking at is what it looks like in the state of New Jersey. So taking a big step back, we definitely want to say that, acknowledge first, and I'll take a large step back, that premature birth has gone down in the last few years. We have just got finalized data around that, and that's one of our larger focus for our program. And we also know that preterm birth is directly impacted by infant mortality, being that babies that are born preterm are 7 times more likely to die from preterm birth in New Jersey from infant mortality. So I want to pass it back to Carrie as we're thinking about how we're proving our impact and thinking about preterm birth and infant mortality and really building those numbers around that. But I think that's a really wonderful question.
Thank you, Christine. I agree. It's a wonderful and critically important question. I think you summed it up beautifully, Christine. I think if I could just summarize, we'll continue as an organization to look at outcomes in the state of New Jersey and in those focus areas that we talked a lot about, in those indicators that we talked about. And I think also, Christine, as you mentioned, turning it back to how participants and other community stakeholders are talking about, in their words, how they're being affected in these areas that we see as affecting the rates that you're asking about, I think is important too. So again, just to kind of summarize the different pieces that Christine was discussing, looking at outcomes in the area coming from various data sources, while also looking at our feedback from participants and how they're talking about it in their words, and how those come together.
And staff added a question here. Thanks for your presentation. Are there any plans to include and or explore more upstream strategies to address food insecurity? I believe you mentioned Atlantic City does not have a grocery store.
Thank you, Steph. Another great question. I will say that since those newspaper clippings that were in the presentation, there has been plans to move forward to have a supermarket in Atlantic City. So while it's not present and that brick and mortar is not up as of yet, we know that it's in progress. And I believe they had a groundbreaking this year, if I'm not mistaken. As far as addressing food insecurity, we're looking and really branching out with other organizations that are already doing this wonderful work, such as our local food banks, anyone who's doing food drives. Even we're thinking about faith-based organizations and other organizations that are really doing the work and spans across all across the state. Because while we started this program in Atlantic City, we actually took it across the state. So all the way up to the North New Jersey and everyone in between, we made that reach. So a lot of ground to cover when I say that, but I'm just saying that we want to really work in with those who are doing the work. And that I think that's a big strength on our side with those community partners that are working on these issues around food insecurity.
And while we wait for other folks to chat in their questions or come off mute, I actually ask Christine's question again, because I'm actually very curious what work you all are doing in your states, community engaged work around, if specifically around food insecurity. And Christine, if I'm paraphrasing your question incorrectly, please jump in, but just wanted to pose that again because we had some folks join.
Absolutely. Yeah. And I'll actually build on that a bit. So since the Seedlings program, that was really a pilot for us, as you all saw. So we had that 3-month program. We kind of wanted to see and get our feelers out there and see how well it went. It was really wonderful success. Since the Seedlings program, we have had other virtual programs during this time of the pandemic that dedicated itself to other type of food insecurity, food justice type of conversations. We have had the food bank. We had our local ShopRite or supermarket, if you're not in the area, so ShopRite. And nutritionists and nutrition educators really speak to our populations about how to make healthy meals at home and what could be done around that. Also, we're looking into possibly doing another iteration of the Seedlings program this year. So we're just trying to put our minds around what we can do, but really working with others that are already doing the work, I think is what we're working on doing. So we have crops, as you saw in our presentation, but the local food banks and others that are really already latched into this space, we want to make sure that we're working in partnership to not work in silos, but to do this work together.
Thank you again, Christine and Carrie. So I'll pause here for just another moment or so if we have additional questions. Okay, well, thank you all again for watching the presentation and for joining us for our Q&A. Their slides are present on the Cadmium platform, as well as a handout that you all mentioned towards the end of your presentation that is also linked. And looks like Christine just dropped some information in the chat. So thank you all again. I hope you've enjoyed day 3 so far. Please tune in later this afternoon for our closing plenary. Hope to see you there. Otherwise, have a great rest of your day. Bye all.